Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance, as well as the author of Migraines and Epilepsy, How to Find Relief, Live Well, and Protect Your Brain. And today we're going to talk about I would have to say it's surprising results, although it's not really surprising. The links between your gut and the bacteria in your gut and your brain have just exploded in the past decade, to the point where if your neurologist or epileptologist is not talking to you about gut health, it may be time to find somebody who's a little bit more current with the medical literature, especially considering that 1/3 of epileptic patients can't find relief with medications. So intractable epilepsy is epilepsy that's not responding to medications, and up to 30%. Like, that's huge. It's a big chunk of seizures that we can't control. And a lot of this has to do with protecting your brain, which is not something we usually talk about. We just try to medicate till we suppress the brain so that one cell is not talking to the other cell, and when they are no longer communicating, we pat each other on the back and say we did it. But that doesn't fix anything. It just suppresses the brain. And meanwhile, everything that's going on is continuing to go on and potentially damage the brain. So this particular study used cipro, a fluoroquinone antibiotic, which I'm not suggesting we would use cipro or any antibiotic for that matter, but it goes to show how much affecting the gut bacteria can have a role on seizures. Now, this was a small study, but these are people that were on drug-resistant epilepsy, so intractable. The average number, they were all on polypharmacy, so multiple meds. I want to say the average number was 3. These people were very hard to control, and the drugs that they were on were not working. And all they did, a small study, I think there were 23 people in the study, and all they did was give them cipro for 5 days. Again, not the solution I would suggest, but cipro for 5 days. And keep in mind, when we talk about seizure improvement, we look at a greater than a 50% reduction. It's usually most studies look at. So if your seizures get cut in half, you're considered to be a responder. So, if you're having 5 seizures a week and all of a sudden it's down to 2.5, like, that's a huge difference, especially considering that every seizure damages your brain on top of the brain damage that's already occurring because you're prone to seizures. So they found out that by giving the cipro, the Bacteroides class went up and the Firmicutes class went down. Both of the directions of each of those have been shown in other studies to be favorable for seizures. So in other words, people with high Firmicutes are more likely to have seizures, and people with low Bacteroides are also likely to have seizures. So bringing that ratio into a favorable level is a good thing. Again, I wouldn't suggest cipro. There are certainly other things, but it gives you an idea of how powerful. So what happened in 5 days with these people who were already getting massive amounts of medication that were not working? Well, within 4 weeks of the study, 70% of them were responding with 50% or greater less seizures. At the end of 12 weeks, so this is 3 months later, 74%, like, that's a huge response from people that were not being controlled from multiple medications using something, not that cipro simple and doesn't have its side, but a simple approach to change the gut bacteria had a massive change in these people's epileptic exposure experience, number of seizures they were having. Like, that's just staggering. Beyond the scope of this post to talk about how to change the gut bacteria, but keep in mind that things like the ketogenic diet will improve that ratio as well, and that's one of the reasons why it can be such a powerful tool for people with seizures. As always, I will post a link to this particular study in the description, as well as a link to my book if you're interested in finding out more. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.